Well, next to skin cancer, prostate cancer is the leading cancer affecting men in the United States. And once a man is diagnosed, he joins a fraternity of people from all walks of life. Take a look.
What do John Kerry, Arnold Palmer, and Pat Robertson have in common? They're all members of a club none of them wanted to join, men diagnosed with prostate cancer. It's a large fraternity. Each year, doctors break the news to about 200,000 American men. 1 in 35 will die from it. A man has the greatest chance for survival if his prostate cancer is detected early. The PSA screening test is recommended for men as young as age 45. There are many different types of treatments, and patients sometimes have difficulty deciding which is best for them. One useful tool to help with that decision-making process is a new book called Prostate Cancer Survivors Speak Their Minds. In it, celebrities and ordinary men recount the intimate details of how they dealt with their prostate cancer.
Interesting, personal and close to home. It's a book called Prostate Cancer Survivors Speak Their Mind, and advice on options, treatments, and alternatives. Arthur Burnett, M.D., and he's here with us. He's the director of Male Consultation Clinic at Johns Hopkins University. And doctor, it's good to have you with us.
Thank you. I'm glad to be here.
What did you learn in this research? You did extensive research.
Well, you know, certainly this book is meant to be a celebration of men who've had prostate cancer, telling their story so that others can learn from it. And we learned from a personal side, the human side, about how men have to confront this disease and move forward with their lives.
I'm supposed to ask you, having been one of them, but is this a traumatic event for men when they learn they have prostate cancer?
Oh, absolutely. Prostate cancer will claim lives, and it has such an impact because of its prevalence. It's such a highly frequent disease that men will confront in America. And even in the management of this disease, it could impact various functions, urinary function, sexual function. So to be aware of this disease and to address the complications that may occur with managing this disease is very important to understand this.
Find out what causes it. You know, there's one school that says, well, you know, testosterone is bad for you, and another one that says it's not testosterone, it's dihydrotestosterone, and testosterone is good for you. So what'd you find out, or have you found out anything yet?
Well, we continue to study this disease and what are the factors that are involved. Hormones, testosterone is important, but there may be genetic factors, there may be dietary factors. So we still have to study this more and more and try to figure out how we can cure this and maybe even prevent it in men who would be susceptible to having it.
Does the PSA work, do you think? Is that a good test?
Well, the PSA, which is a blood test, is a test that does help us screen for prostate cancer, although it's nonspecific for prostate diseases. And so we have to be aware that it may be abnormal and lead us to do some additional tests that may allow us to make the diagnosis of prostate cancer and distinguish it from other prostate diseases like prostatitis.
Apparently this strikes black men with more intensity than whites. Why is that?
Well, you know, this does disproportionately affect men of African-American descent. And there may be genetic factors that play roles there. So we're still trying to figure this out, but certainly there are other factors that lead to some of the higher risks that black men face in terms of mortality, and that may have to do with socioeconomic inequities, failure to actually get diagnosed early, and things of that sort.
All right, these guys that you talked to, and I was one of them, what did they tell you?
Well, you know, it's interesting. Everybody has a nice story, and you have one in there as well, and we celebrate your telling your story. And I hope that each of these stories will connect with those who read the book. Maybe there's a story that each person can somehow say, I identify with this, and I can understand different aspects of this disease in terms of how I confronted it. I tell little portions of their stories as well. My co-author, Norman Morris, tells these stories beautifully with each person. But I also try to emphasize certain messages, certainly try to clear up areas that may be misconceptions, and try to get men on track with thinking about how to deal with the disease.
Well, the two problems with dealing with it is impetus, which most men don't want to be impotent, and the other is incontinence. Men don't want to go around wearing a diaper, so...
Well, these are some serious issues. And in fact, those have been some of the issues that have led some men not to even want to get diagnosed, not to even want to talk about the problem, not to even go into the doctor's office to have a discussion about possibly getting the right test to be diagnosed. But the other alternative is that you could actually develop the disease and die of it. And that's not an alternative that I think men should accept.
My brother had it, and they treated him with radiation. It didn't work. It spread to his lungs, then it went to his brain, and he died. He died early.
And that's an unfortunate thing.
Yeah.
And so I think we need to have better attention to this disease. Hopefully this book and others and your program here to allow us to talk about this is very important.
Cases, is it 150, 200,000 a year?
About 200,000 men per year get diagnosed with prostate cancer, and about 30,000 men every year will die from prostate cancer.
That's horrible.
Absolutely.
Well, it was publicized so much. You know, John Kerry called me, and he was very kind to call, and he said, did they get the nerve? Well, I mean, you know, when they operate, they take the nerve, and the nerve is what does the job on the impotence thing.
Well, you're absolutely right. And we've had some innovations with Dr. Patrick Walsh, whose namesake I have as a chair at Johns Hopkins, has pioneered various approaches, and others have contributed as well to doing the surgery that we do, radical prostatectomy, better in terms of nerve sparing, understanding that the nerves in the pelvis regulate blood flow that have to do with sexual function. So if we understand the anatomy better, perform the surgery much more proficiently than ever, hopefully men will have the best outcomes to cure their cancer and retain the best outcomes of their sexual function.
What do you want to tell people that are watching this program now? What should they do, and who's at risk?
Well, I think all men are at risk. This is such a pervasive cancer out there that all men, I think, should be aware of it, have discussions with their physician about possibly getting screened. All men should have that discussion, certainly by the age of 50. If you're in a high-risk group, which is African Americans, or with a strong family history, at age 40, you should have that discussion and consider the basic evaluation, which includes the PSA test, the blood test, as well as the digital rectal examination, an examination to examine by direct finger exam the prostate. Both are important, not one alone stands, and perhaps if there's understanding that something's abnormal with either of those tests, we may then proceed with a prostate biopsy and make the diagnosis. And then have the discussion and have the book like this that helps you understand the risks and how we can proceed to give you the best outcome.
Well, ladies and gentlemen, I want you to know when they came to me, I had the PSA and then I had the biopsy, and that's not a fun thing either. None of them are fun, but it's one of those things that you just say, look, get that rascal out of me. I do not wish to have it. I don't want it spreading. Get rid of it.
Well, you are absolutely right, and I think it's important to move forward, identify the very best specialists in the area, and address this properly.
Well, that was 15 years ago, and there was a wonderful doctor down in Miami who's Israeli and who was really the pioneer of this arthroscopic technique where he used a robot. And I mean, I was riding a horse about a week after I'd had the surgery.
Well, there you go. You tell a wonderful story. And Arnon Krongard, who's a friend of mine, he's a urologist you speak of, down in Miami, has certainly led the way with other approaches, the laparoscopic approach, which is now emerging into a robotic approach, are various approaches, including the open surgical technique to carry out the radical prostatectomy. And all of these approaches, I think, are very good approaches if done by expert surgeons.
Well, it's an amazing fraternity. Rudy Giuliani called me. He had, I think he had radiation. He's doing great. He's strong as a horse. And others, it just depends on what they do. I didn't want radiation.
Well, you make an important point. Now, radiation is an alternative for early stage disease as well. And so for each person, they need to have a discussion with a specialist and find out what is the right approach for them. And that's the thing to know.
Well, doctor, this book is called Prostate Cancer Survivors Speak Their Minds. Arnold Palmer, Ken Griffey Jr., Robin Cole, and yours truly. Okay, that's something that a lot of people don't want to talk about, but it's one of those things you don't want to die from it.